for a battle that takes place 365 days a year. We know that the World AIDS Day is really just a symbol, an opportunity not only to raise awareness of the ongoing global challenge, but to raise our sights and to take stock of our collective work in combating HIV/AIDS. For those around the world and here at Columbia who are working on the front lines, today is also a chance to gather and to reflect, both on what works and on what doesn't work. Also to assess the long path ahead. This year, World AIDS Day theme is universal access and human rights. So it's fitting that this symposium on HIV scale-up in global health systems is co-hosted here at Columbia by two organizations that have admired leaders in bridging the treatment gap. Both the William J. Clinton Foundation and Columbia's International Center for AIDS Care and Treatment Programs, or ICAP, have demonstrated transformative leadership in expanding access to prevention and treatment of HIV/AIDS. Since 2004, ICAP has supported HIV/AIDS prevention, care, and treatment programs and related activities in 13 African countries. It was a great privilege of mine, with my wife Jean, to visit several of them at the very start of this a few years ago. Focused on strengthening health systems through comprehensive programs that address HIV/AIDS as well as related health issues, ICAP uses a family-centered approach, focusing on service programs, training, research, monitoring, and evaluation, as well as education. It is a proven model of effectiveness even in areas of limited resources and challenging conditions. ICAP has provided more than 750,000 people access to HIV care and 358,000 individuals with HIV treatment, and has indirectly benefited millions more. ICAP is one of the many initiatives at the Mailman School of Public Health, led by our new wonderful Dean, Linda Freed, and indeed throughout Columbia University, making great strides forward in the fight against HIV/AIDS from northern Manhattan to South Asia. Across the university, the crisis of HIV/AIDS is addressed through programs working in a range of disciplines and focusing at both global and local levels. For example, our School of Social Work, the Social Intervention Group, is working with the University of Malaya to identify forces that fuel HIV/AIDS, the epidemic among commercial fishermen from Malaysia and neighboring countries. Columbia addresses the epidemic in our own community as well through the HIV Center for Clinical and Behavioral Studies, an organization created in partnership with the New York State Psychiatric Institute. Through this initiative, we conduct interdisciplinary research on HIV/AIDS related issues and offer outreach and support to HIV-infected and affected populations in New York City. These are just a few of the many ongoing initiatives across Columbia's schools and institutes. We are deeply grateful also to President Clinton and the William J. Clinton Foundation for co-hosting this event. President Clinton has been an extraordinarily important leader in combating the HIV/AIDS crisis. It is worth noting that in 1995, it was President Clinton who made the first official proclamation of World AIDS Day, setting a precedent that prompted other world leaders to follow suit. And since President Clinton has left office, the William J. Clinton Foundation's work has made huge strides in closing the gap in access to HIV/AIDS care. In 2002, President Clinton's HIV/AIDS initiative was established, working both with drug manufacturers to lower prices for antiretroviral treatment and with local governments to improve healthcare systems and to deliver medicines. I'm also glad to say that despite his extraordinary global schedule, President Clinton has found time for several visits to our campus. We are very pleased with our collaborations. We are sustained by his being in the neighborhood on 125th Street, and we are also deeply proud of the fact that he is a friend and a parent. The work of organizations like the William J. Clinton and Foundation and ICAP have had both tangible consequences on the lives of those affected by AIDS, while also paving the way towards improving access to critical HIV/AIDS care. Recent figures from the CDC note that at the end of 2008, an estimated 4 million persons in low and middle income countries were receiving therapy, representing an increase of 36% over the previous year. So we are very proud that the Mailman Schools, ICAP, and the program and the Clinton Foundation have helped bring us together today to discuss the global and domestic state of AIDS. Let me also say that just as we're in a world in which the financial or the media industry is experiencing a constriction in coverage of foreign news, it's all the more important that we have events like this to help us understand what's going on. So now I'd like to introduce the panelists. Of course, President Clinton, founder of the William J. Clinton Foundation, Dr. Wafa El-Sadr, Director, International Center for AIDS Care and Treatment Programs, also a MacArthur Fellow, C. Virginia Fields, President and CEO of the National Black Leadership Commission on AIDS, Kaylee Lindsay, Senior Director for Federal Policy, Harlem United Community AIDS Center, and Dr. Stephen Lewis, Co-Director of the AIDS-Free World. We're very pleased and proud to have all of these distinguished individuals here today. Thank you.
Well, all of us having been introduced, we'll start immediately, and I will direct the first reflective question to the President, which is, I think, both an obvious question but an important one, which is quite simply, why hold an event of this kind on World AIDS Day at this moment?
It is the question, though. I'm honored to answer it, and let me begin by thanking Dr. Bollinger, President Bollinger, and Dean Freed for having us back at Columbia. And I want to thank our panelists. I think we should do it for two reasons. Because, number one, Americans have tended to grow complacent about the challenges in America and about what it would take for us to adequately meet them. And number two, Americans, I think, tend to assume that because of the dramatic increase in activity in the rest of the world, because of the Global Fund, because of the PEPFAR program that President Bush initiated, because of the work of the Gates Foundation and the work that our foundations do and others, that we're on the way to a complete resolution of this globally. And I don't think either one of those things is true. So I wanted to do that. In America, we have discrete populations of Americans where the AIDS infection rate is going up. We still don't have everyone on treatment. We still haven't done as much as we could do on testing and prevention and other things. And in the world, I think we can say with some conviction that no one will die of AIDS this year because the drugs are too expensive or in short supply, but a lot of people are going to die of AIDS and malaria